Hi all, the Community Pharmacy Consultation Service, or CPCS, is a new advanced service commissioned by the Department of Health and Social Care, which goes live on the 29th of October 2019. It focuses around urgent medicine supply or low acuity minor illness conditions. The aims of the service are around diverting patients with lower acuity conditions to community pharmacy. The pharmacist is the first port of call for these customers. This in turn will reduce demand on other urgent care settings, and patients will be able to appropriately manage their health better. The other aim of the service is to appropriately manage patient requests for urgent medicines or appliances. The requirements of the service are set out in the service specification. The major requirements are around clinical governance processes being up to date, the pharmacist being able to access the summary care record, and the pharmacy having access to the NHS shared mailbox and it being used on a regular basis. The consultation room must be a confidential area where the patient cannot be overheard, and a computer must be available. SOPs must be signed and read by all team members and reviewed annually. The first part of CPCS is around referrals for minor illness. The pharmacy will provide patients with self-care advice and support, including access to printed information on the management of minor illness conditions. The outcome of the referrals received in relation to minor illness may include giving advice, sale of OTC meds, or referral to other healthcare professionals. Only patients who have called 111 and have been referred to the pharmacy are eligible to receive advice and treatment under this service. Patients presenting in the pharmacy with minor illness conditions cannot be diverted into this service. They must be treated in the usual way by community pharmacy. So how will the minor illness referral work? NHS 111 will use Directory of Services to offer patients a choice of pharmacies which are participating in the Community Pharmacy Consultation Service based on location and availability at the time of the call. NHS 111 will provide the details of the selected pharmacy to the patient, advising them to attend within a set time period. In terms of referral to the pharmacy, NHS 111 will refer patients to the pharmacies using their electronic IT system as the default process, with NHS Mail as a backup process. Where a pharmacy has received a referral but has not been contacted by the patient within 12 hours of the referral, the pharmacy must make an attempt to contact the patient using the contact details set out in the referral message. If the patient has not made contact during the next working day, the pharmacy can then close the referral via the IT system as no intervention made. Now, if no electronic referral message has been received by the pharmacy and the patient has made contact, the pharmacy can contact the NHS 111 healthcare professionals line and confirm whether a referral has been made, and where appropriate, reconfirm the patient's NHS number and GP details. It's important that the pharmacy is constantly checking their farm outcomes or similar IT platform, which NHS 111 will use, and also the NHS Mail shared mailbox. In terms of farm outcomes, the farm alarm is absolutely imperative as it flashes every time a referral arrives. Now, the consultation with the patient is usually face-to-face, but can also be done over the telephone if appropriate. Remember, the aim here is to provide self-care advice on the management of this low acuity or minor illness condition. At the end of every consultation, the pharmacist should give a closing statement to the patient. If your symptoms do not improve or become worse, then either come back to see me or seek advice from your GP. You can call NHS 111 or 999 if the matter is urgent and a pharmacist or GP is not available. There will be times when you may need to escalate matters or seek additional advice. You can do this in 3 ways. Option A, refer the patient for an urgent in-hours appointment. That will be usually something like Monday to Friday, 8 AM to 6:30 PM in their general practice. Option B, call the NHS 111 service when the patient's own general practice is not available. Option C, refer the patient to A&E or call 999 if absolutely urgent. Now, details of the referral and the outcome of that referral must be recorded on the CPCS IT system. The information will be used to generate the month-end payment claim for each pharmacy, which you would then make via the My Service portal. Where it is considered clinically appropriate, a notification can be sent to the patient's GP practice on the same day that the supply is made, or as soon as possible after the pharmacy opens on the following working day, ideally via NHS mail. Where the notification to the GP practice is undertaken by hard copy, the National GP Practice Notification Form should be used. The second part of the Community Pharmacy Consultation Service refers to urgent medicine supply. In an emergency, and at the request of a patient, a pharmacist can supply a prescription-only medicine without a prescription. And this is to a patient who has previously been prescribed the requested POM. The usual requirements for emergency supply still stand. In the next few slides, we'll guide you through the process. NHS 111 will use a directory of services to offer patients a choice of pharmacies which are participating in the CPCS based on location and availability at the time of the call. These patients will be referred via the electronic messaging IT system as the default process, with NHS Mail as a backup process. NHS 111 will provide the telephone number of the selected pharmacy to the patient, advising them to call the pharmacy in the following 30 minutes so that the pharmacist can assess the need for urgent supply of the medicine or the appliance and arrange a convenient time to attend the pharmacy. Now, if no electronic referral message has been received, like with previously, the pharmacist can contact NHS 111 to confirm whether a referral has been made or not. Where there has been no referral made and the patient hasn't been referred, that does not mean you can't do an emergency supply. The emergency supply legislation will still stand, and you are allowed to give emergency supply, i.e. give an emergency supply at a request of a patient and at the expense of a patient, and also via any locally commissioned service. Where a pharmacy has received a referral but has not been contacted by the patient within 30 minutes of the referral, the pharmacy must make a reasonable attempt to contact the patient using the contact details on the referral message as soon as possible. If the patient has not made contact before the next working day, then the pharmacy can close the referral as no supply made. No payment is due on this. With regards to a telephone call with the patient, the pharmacist will interview the patients to assess the suitability and legality of making an emergency supply. If it's not possible to make an emergency supply due to prohibitions within the legislation, the pharmacist will ensure that the patient is able to speak to another appropriate healthcare professional. Patient consent for receiving the service and for the pharmacy sharing information with the GP's practice is absolutely essential. With the patient's consent, the summary care record must be checked by the pharmacist unless there is a good reason not to do so. In this circumstance, the reason for not checking the SCR should be recorded. The pharmacist can use the EPS tracker to see if a prescription for the patient is available to dispense. If a prescription is available, then this should be downloaded and used to fill the urgent supply need. Now, in terms of recording and documenting, details of the referral and the outcome of that referral must be recorded on the IT platform, whether that's Pharm Outcomes or any other IT platform that is used. A blank FP10D EPS token must be used to record any medicines provided to the patient, where they are claiming exemption from prescription charges. The dispensing token must include the following: the full name and address and date of birth of the patient's NHS number, name, strength, and form of the drugs requested, including quantity, the date of supply, name and address of the patient's GP, and NHS 111 referral ID. The patient or their representative must complete the back of that EPS token, and the patient and their representative should be asked for evidence of entitlement as normal, as per the general process for NHS prescriptions. These tokens must then be sent to the NHS BSA as part of the month-end submission, clearly separated within the batch and marked Cpcs. It's important that a notification is sent to the patient's GP, preferably on the same day or the following working day. Where the notification to the GP is undertaken via hard copy, the notification form, the standard notification form, should be used. A consultation fee of £14 will be paid for each referral. You would enter your data as normal onto your IT platform and then claim via MYS each month. Now, CPCS puts us at the forefront of patient care, and it's important that we get the processes right, and it's important that we follow up on those referrals that are sent. Thank you for listening.